Tell us about this, Danny.
Well, okay, so Danny is a fellow I met in probably early 90s anyway. I came to town here and joined a practice, and he attended my church, he and his family, his wife and 2 kids, and they were maybe a few years younger than me, and we got to know them, and you know how you do, you just see them here and there, and I noticed that he was struggling with some issues, and as we talked, it was a pretty brittle diabetes problem that he had. And maybe 6 or 8 years later, I noticed that he wasn't working anymore, and a lot of it was related to the number of doctor's appointments and hospitalizations that he was having for this brittle diabetes. But he didn't really get it, and he didn't take very good care of himself. He didn't follow his blood sugars well, and ultimately, a few years later, he had lost both legs because of the neuropathy. He had kidney failure because of the renal issues, and his eyesight was very poor, obviously because of the retinopathy. And this was maybe in his late 30s. And at that point, basically he was not working. He had lost his family. They kind of had moved on because there was so much effort involved in his care. And a few years later, he passed away, 46 years old. So if there's a way with networks that can support our people with data that we can really dig in and find our sickest patients and help them, reach out to them in not just the medical visits, but these social issues that clearly much of his problem wasn't from the actual diabetes, it was from all the other stuff in his life that kept him from getting good medical care.
And Danny isn't a terribly rare story that we see in medicine. There is the complexity of the disease process itself, but there's also the complexity of the number of providers that kind of disease process will take, and the coordination of care between those providers. And there is the incredible ability for care to be dropped, care to be disjointed, uncoordinated. And I believe that that's one of the big things that we want to try to improve in the network is how do we make sure that care is uniformly given across a number of subspecialties, across a number of organizations, and how can we improve that coordination or that efficiency? These are the things we want to work on in the organization, not working on it from one organization, but working on it from a network of organizations, saying how can we improve the communication, how can we improve the efficiency, how can we improve the overall workflow of any disease process, and on top of that, how do we improve the workflow of preventing Danny from even getting some of these chronic diseases early in life that you mentioned. I think those are the main keys of what we're trying to do in the organization of the clinically integrated network, amongst many other things, but those are the main things that I see we're going to try and focus on.
I think one of the things that points out is the network is actually trying to pull together somewhat distant institutions that share patients. And this is an area in central Minnesota where a lot of patients come down to CentraCare for care, but they remain in their local medical communities for most of their care. We're trying to find ways to connect those institutions together so that care is seamless. Folks can come here, they can go there, they can go there. Whichever provider they have is going to be able to get the records, get the data that they need to really get the full picture on each one of these patients.